Fred Train.
Oh, hey.
Hey, my name is Roberto Canales. I'm the PA who's going to be doing your medical history and your physical exam today.
What's a PA?
Physician assistant. Very similar to nurse. Are you familiar with a nurse practitioner?
Oh, yeah.
Very similar to nurse practitioner. Why don't we go and get started this afternoon? Is that all right?
Mm-hmm.
All right. Well, I was looking at the notes that the medical assistant had written down, and they mentioned, or rather she mentioned that you've been having problems with a lot of fatigue, feeling tired a lot.
Yeah.
Okay.
Yeah.
Can you tell me a little bit more about that?
Well, I'm tired all the time. I can't keep my eyes open sometimes. I'm even falling asleep at work, and that makes me think I might get in some trouble with my job because of it.
Okay. What do you mean trouble with your job?
I'm falling asleep at work.
Okay. And when did this start?
It's been happening for a long time.
All right. And
A couple years.
Couple of years. And during this couple of years, how has it changed?
Well, now I'm falling asleep like about 3 or 4 times a day now.
3 or 4 times a day? And have you ever had this before?
Well, I mean, it's been going on for a couple of years.
Okay. So during this time, can you describe exactly what's happening?
Just falling asleep. I mean, I'm tired when I wake up. I'm tired a lot and I'm just tired.
All right. And because of the tiredness, have you ever fallen asleep while driving?
No.
Okay. And does anything make this worse?
No.
Does anything make this better?
Not really.
All right. And I'm sorry, I haven't asked you, are you married?
Mm-hmm.
Married to a woman?
Yes.
And has your wife commented that you snore?
Yeah, I think it's gotten so bad she sleeps in the other room most times now.
And do you ever wake yourself up at night because you snore so loudly?
Yeah, pretty often.
All right. And because you wake yourself up at night, with snoring, overall, how would you describe your sleep?
Mm-hmm. Well, when I wake up, I'm still pretty tired. So I don't really feel like I ever get really rested, you know.
Okay. Do you have any problems concentrating because of this?
Yeah, when I watch TV, I fall asleep. I don't even think I make it through a TV show at night.
All right. And because this seems like it's been going on for a while, do you think you have any concerns with depression as a result of this?
I mean, a little bit, but I mean, wouldn't you?
Okay. And have you had any concerns regarding anxiety also because of this?
No, I don't really have that.
How about panic attacks?
No.
Any heartburn?
No.
And do you have any other medical conditions?
My blood pressure's high, and I have some low thyroid.
And have you been diagnosed with high blood pressure?
Yeah.
What medication do you take for that?
It starts with an atenolol?
Atenolol. And do you know how many milligrams you take?
No.
How many times a day do you take it?
Morning and night.
And do you take it as prescribed?
Yeah.
And what do you take for your low thyroid?
Synthroid?
And do you know the milligram dosage on that?
No, it's kind of a pill like that.
And how often do you take that?
Twice a day as well.
And you take it as prescribed?
Mm-hmm.
Okay. And do you have any allergies?
Nope.
No. How about, do you smoke?
No.
So no cigarette use?
No.
How about chewing tobacco?
Nope.
Okay. And do you drink alcohol?
I have a couple beers every night.
So that's kind of Monday through Friday every night?
Yeah, I mean, I usually have a beer with dinner, and then, when I'm watching TV, so probably about 2.
Okay, and have you been drinking a couple of beers every night for a while now?
Yeah.
So more than a year, less than a year?
Well, long, probably since I was 21.
All right. Do you take any drugs?
No.
So no marijuana?
No, I don't touch that stuff.
All right. And have you had any surgeries or hospitalizations?
Yeah, about 10 years ago, I had a stomach surgery.
Okay. Can you tell me a little bit more about that?
Like a hernia? Like what do they call it? Your belly button?
Like for hernia surgery?
Yeah.
And Do you know if you had any complications when you had the surgery done?
I don't think so.
We're pretty much through with the medical history. Is there anything else that you'd like to add that maybe I haven't asked you?
No.
Okay. Well, I'm going to step out for a couple of minutes, and while I'm gone, I'd like for you to go ahead and put on the gown. You can leave your underwear on, but if you don't mind putting on the gown, and I'll be back in a few minutes.
All right.
All right?